Lung cancer is basically a cell that's abnormally mutated and it continues to grow. That's the definition of cancer. And lung cancer basically means the abnormal mutated cell began in the lungs. There's two different kinds of lung cancer categories. We divide them into small cell lung cancer and non-small cell lung cancer. Small cell happens exclusively in smokers. So smoking is a big risk factor. Non-small cell, they also occur, they're higher risk in smokers, but they also occur in non-smokers.
There are other risks, including secondhand smoke, which is a risk for people that have heavy exposure. Radon gas, diesel fumes have been shown to be an issue in some people, and then other occupational exposures, things like arsenic and silica, asbestos, are associated with increased risk.
Well, the most common way it's detected is people present with symptoms. Unfortunately, the problem is symptoms often develop at later stages. The best way to detect lung cancer is for people who are at higher risk is to have a screening CAT scan.
When somebody goes and gets a screening scan and we are able to detect an early stage tumor, we have many more options including minimally invasive surgery, to eradicate that or rid them of their tumor and get them back to their life.
My role as nurse navigator is to be the guide and advocate for the patient. When patients come, they're very anxious. I think they're overwhelmed. They're not sure, and they're pretty hopeless, not knowing what kind of care they need or what's going to happen to them.
So at Franciscan, just like all the major academic centers, we have a multidisciplinary approach to cancer care. And that means we all talk to each other all the time. We talk on our cell phones. We have tumor boards. Everybody works together to come up with a single unified plan.
We take care of a patient as a whole, and for lung cancer, taking into account all the different steps, we include the radiation oncologist, the medical oncologist, and that's me, the surgeons, the lung doctor, the radiologist to read the scans, the pathologist to read the biopsies, and we come together as a group.
Well, what we're building here, and we're right on the threshold of it now, is to have everything state-of-the-art and all under one roof. It's a one-stop shop.
Our partnership with Rush just started this past month. I'm excited about that. It gives more doctors, more surgeons, more different types of procedures that can be done, and it brings a lot of experience.
The cutting edge treatments that are available here at Franciscan for lung cancer include our ability to diagnose really small tumors now with robotic bronchoscopy, the Monarch system. That specialization that we've been able to develop at Rush and our program in Chicago has led us to perform the most of these procedures. And our association with Franciscan is a combined partnership to allow us to provide that expertise in the community here.
I think that there's a lot of fear that patients have about lung cancer treatment in general, and they think of surgery in terms of having a large incision that goes from the front to the back, and all kinds of chronic pain and complications from that. And with minimally invasive robotic surgery, avoid having to do large spread the rib types of chest surgeries.
There are several treatment options for early stage lung cancer. The primary treatment is surgery. And for those patients who decide they don't want surgery or they're not a good surgical candidate, we have excellent radiation options using a very precise form of radiation called SBRT. So this is a pinpoint radiation directed only to the tumor. Now with the technology that we have available, we can do it in as few as 3 to 5 treatments.
I think we're doing better with regards to providing resources for patients who are smokers. So smoking cessation counseling, I think, is key in our clinic. We are doing incredibly well with improving outcomes of both curative stage, early stage, and advanced stage patients.
I would choose Franciscan Health because of our faith-based ministry. Joyful service, compassionate caring, always serving others, thinking of others. You always want people to know, you're there for them. You know, like I said, my patients call my phone just to talk to me.
So if that you have a history of significant smoking and exposing yourself to risk for lung cancer, a simple low-dose radiation CT scan can detect an early stage tumor that you may not even have any symptoms from. We can get back to the aggressive screening programs that Franciscan and other places have employed to save more lives.